I'm Eddie. I done the Intro to Medical Sciences in 2016, 2017 at Kelvin College, and now I'm a final year medical student at Glasgow University. Preparing for the interview is a difficult challenge because you're not going to be as prepared as you want to be, and you're not going to know the questions beforehand, and you're not going to know exactly who's going to be interviewing you and what they're going to how they're going to pressure you, what they're going to say, how they're going to put these questions together and try and stress you out. And you're not really going to know how you're going to react to that. So all you can do is prepare as best you can. Think about your skills and your experiences that you've had so far coming up and things that you're able to talk about, and practice talking about them to your friends or to the mirror and see how it is that you're coming across. Maybe even practice it on a video and try and get a list of standardized questions that might get asked at medical interviews. There's loads of them online, and there's actually a book that's really quite thick that just contains loads of standard interview questions and ideal model answers for them. You may want to have a read into how the NHS is structured, what it means to be a doctor, and good advice from people like the General Medical Council who oversee the professional side of the doctor profession, and they publish lots of advice that I'm reading at the moment to prepare for an exam. Their all their advice is all about what it means to be a professional, and it all comes from a couple of cases where doctors have went wrong, and it's good to know some of those cases as well to go into the interview, because you might be asked things like, what do you know about Harold Shipman, who was a GP down in England who was actually killing his patients. There's a case in court just now that you might want to be familiar with. That's the Lucy Letby case. These are things that can come up in an interview that aren't exactly related to your skills and development, and things that I might be able to tell you about to keep an eye out on. Things that will be personal to you, you'll know about. Just get them all out on a bit of paper and just really practice saying them out. Try and hammer them into a question. If some interviewer asks you a question and it's not directly related to one of your skill sets or something that you've experienced, you can always sort of bend the question and say, oh yeah, that was a good question, and that actually reminds me of this time I had this experience, and talk a wee bit about your experience and how you're going to be a good medical student. And that's another thing to mention, is that the interview is looking for good medical students. It's not looking for who's going to be a good doctor, because they're going to teach you how to be a good doctor. It's all about how you're going to be the best medical student. So things like resilience, work-life balance, your studying skills, how well you get on with other people, and your communication skills are all really important things that you will want to mention. So for the interview, you want to talk about all these skills that you've got and these skills that you're going to get over the next couple of months in SWAP. And a lot of that's going to come from your prep for HE modules. So get through them and get prepared for your interview. Keeping up with what's going on in the medical world is important, and anything that's going on in the news. Obviously, we had COVID recently, and that's still affecting parts of the world in ways that we don't fully understand. There's wars going on, there's famines, and global health is a massive topic at the moment. So it would be useful to know some stuff about that. I would recommend whatever news website that you like. BBC News is my preferred one, and I would just go on there and have a look and read anything that might be relevant to the medical profession. GMC, that's the General Medical Council's website, is good for advice. Doesn't really give you good advice for the medical student interview, but it does give advice on professionalism for doctors. And that's something that we read a lot about in medical school. And it's something that you get asked quite a lot about in the interview process. Things like confidentiality and what it means to be a good doctor, and um, how to use your social media properly and not get into trouble for posting things that you shouldn't be. And there's a whole massive list of things on that website. I found YouTube really helpful, and there's lots of mock interviews on YouTube that you can watch, and you can see people going through a sort of interview process. And I can still remember how helpful some of those videos really were, and some of them were actually quite accurate to some of my experiences in an interview. Arrange a mock interview and try and do it with try and go in with the mindset that you're going to have when you do the real interview, and try and set up a couple of mock interviews. I remember I had my final mock interview was with Amy at SWAP, but before that I'd done a few mock interviews with a few doctors that I knew. I had my family members looking at questions and asking me all these questions that I'd found online about what it meant to be a medical student and all these things about professionalism, and just practicing saying the questions out loud.